When multiple teeth are lost or damaged through trauma or decay, full mouth rehabilitation might be recommended. Full mouth rehabilitation, otherwise known as full mouth reconstruction, involves the artificial rebuilding of all teeth. The laboratory work involved in fabricating these restorations is carried out by local and trusted laboratories here in Australia. Treatment can also involve the repair of your gums, jaws, and other facial structures. Depending upon the complexity of your condition, treatments can be carried out entirely at our practice or by utilizing the skills of other specialist practitioners. Some of the restorative treatments carried out as part of full mouth rehabs include dental implants, dental crowns, veneers, orthodontic treatment, gum or jaw surgery, bone grafting. Some of the most common reasons for full mouth rehabilitations are few or unhealthy teeth, trauma or decay resulting in chipped teeth, excessively worn teeth, gum or periodontal disease, problems with the bite, which is called malocclusion. Inevitably, suffering from one or more of the above conditions can seriously impact self-confidence and quality of life. Using comprehensive planning, we can customize a treatment plan and coordinate a treatment sequence designed to restore both functionality and beauty to your smile. With state-of-the-art treatments such as all-on-4 dental implants, ceramic veneers, ceramic crowns, and the latest bone grafting techniques, outstanding outcomes are provided for every one of our patients. The length and scale of dental rehabilitations depend upon the complexity and severity of the condition. If the state of your oral health is affecting your quality of life, contact us at Melbourne Prosthodontics. With meticulous planning and attention to detail, we will help you smile confidently, allowing you to live the life you deserve.